So Table 5-2 covers the muscles that attach to either the axial skeleton or the scapula, and then onto the humerus. So these are muscles that will cross at some point the shoulder joint. And so they're going to have a more profound action on the direction of the arm. The first group we look at are what are called the rotator cuff muscles. And the acronym for these muscles are the SITS muscles. SITS refers to the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. So in order to access these muscles, I need to reflect back the trapezius and show you that these muscles are deep. So this first run here is the supraspinatus. You can see how its origin is in the actual supraspinous fossa, and its insertion is on the greater tubercle of the humerus. And its action is when it pulls those muscle fibers towards the origin, it's going to cause an abduction of the arm at the shoulder joint. So you need to get in the habit of saying the action and which joint it affects. So abduction, abduction of the arm is when the arm comes up directly to the side of the body. And I will show you these movements after I'm done with these muscles so that I can show you how they work together synergistically to move the arm. So then we have the infraspinatus, and its origin is the infraspinous fossa, and it also has its insertion on the greater tubercle of the humerus. So this one is going to laterally rotate the arm at the shoulder joint. So here's our shoulder joint here. So if you're looking at the direction, say you use the intertubercular groove or sulcus as your point of reference, if that sulcus moves laterally, that is a lateral rotation of the arm at the shoulder joint. And then the third muscle of the rotator cuff is the teres minor muscle. And I will isolate it so you can see better its origin and insertion. So its origin is over here on the medial border of the scapula, and its insertion is on the back side of the greater tubercle of the humerus. So when this muscle contracts, it's going to laterally rotate, which we already talked about. So that intertubercular sulcus is going to laterally rotate, and it's going to weakly adduct the arm. So you see how small this muscle is. It's going to only have a weak adduction of the arm. And adduction is bringing the humerus in to midline. So if your arm was straight out to the side and you brought it back into anatomical position, that is adduction of the arm at the shoulder joint. The last muscle of the rotator cuff is the subscapularis, and as the name suggests, its origin is in the subscapular fossa. So in this anterior view, you can only see part of the subscapularis because the majority of the muscle is hidden behind the rib cage. So I'm going to isolate it here. So you see how it forms this false joint with the thoracic wall. Its point of insertion is on the lesser tubercle of the humerus. So opposed to the other three in the rotator cuff who have their insertion on the greater tubercle, the subscapularis is the lesser tubercle. So when this muscle contracts, it is going to pull the inner tubercular sulcus medially. So it will have a medial rotation of the humerus at the shoulder joint. So, question number 1, what does the T stand for in the SITS acronym? So they are the 4 muscles of the rotator cuff. The T stands for what? Just a hint with the placement of the subscapularis in relation to the serratus anterior. I will add on the serratus anterior here. So you can see that the serratus anterior, it stays very close to the ribs, and the subscapularis is attached to the scapula. So these 2 muscles, they butt up right against each other. And that is what forms that false joint right there, is those 2 muscles. Continuing on with table 5-2, we have the rest of the muscles that are going to attach to the axial skeleton or the scapula, and then they're going to cross over the shoulder to attach to the humerus. And the first one of these is the teres major. And the teres major is one of 3 muscles that is going to have its insertion in the inner tubercular sulcus or groove of the humerus. So again, the teres major, it's one of 3 muscles that inserts in the inner tubercular sulcus. And its job is to extend the arm, and extension of the arm is pulling the arm backwards. And then adduction of the arm. An adduction of the arm is when the arm is out to the side and you bring it back into midline. And it also medially rotates the arm. So again, in reference to the intertubercular sulcus, if it moves inward, that is medial rotation of the arm or humerus. Now we're going to look at the big power muscle movers of the shoulder. So the biggest muscle in the back is this big fan-shaped muscle that is called the Latissimus dorsi. And this is also known as the swimmer's muscle. So if you look at swimmers, they've got a very large and defined Latissimus dorsi. So the point of origin for the Latissimus dorsi is along the spine of the lower thoracic vertebrae and on part of the ribs, as well as the iliac crest. And its insertion is in the inner tubercular sulcus. So the Latissimus dorsi is the second muscle to insert in the inner tubercular sulcus. So the actions of the Latissimus dorsi is to adduct the arm, or bring the arm from an extended outward position back into midline. Again, adduction. And it's going to medially rotate the arm. So the intertubercular sulcus is going to move inward. And it's going to extend the arm, which is to pull the arm backward. The next big power muscle is the deltoid. And the deltoid is this triangular shaped muscle on the shoulder. And its point of origin is all along the acromial end of the clavicle, the acromion, and then the spine of the scapula. and its insertion will be on the deltoid tuberosity of the humerus. And this muscle has different actions depending on which fibers are initiated. So the anterior fibers are going to medially rotate the arm. So they're going to pull the humerus inward. And then the posterior fibers are going to do the opposite. They are going to laterally rotate the humerus. So again, if you think of the inner tubercular sulcus as your landmark, if it rotates outward, that's a lateral rotation. And the deltoid also abducts the arm. So bringing the arm out and away from the body from midline, so abduction, and then extension of the arm. So again, extension is bringing the arm backward. The deltoid also flexes the arm, which is bringing the arm forward. So it flexes the arm at the shoulder joint. The last muscle of this group is the pectoralis major. So the pectoralis major sits very superficial. Just underneath it is the pectoralis minor, and its point of origin is along the clavicle and the sternum via the costal cartilages. So you'll notice here there are cartilages just underneath. So that is its point of origin. And then its insertion is over on the inner tubercular sulcus and the greater tubercle. So the pectoralis major is the third muscle to attach in the inner tubercular sulcus. So question number 2 is, what 3 muscles have their insertion in the inner tubercular sulcus? Again, that's question number 2. What 3 muscles have their insertion in the inner tubercular sulcus? So let's look at what these muscles look like when they are adducting the arm. So adduction is when the arm is extended to the side and you bring it back into midline. So adduction. So the first muscle you see here lit up is the latissimus dorsi. The other muscle you see here is the teres major. The teres minor is also helping. It's just not seen in this picture. And the other one we can see that is working is the pectoralis major. And just for reference in the future, we're going to be looking at this little muscle that's going to help, and that is the coracobrachialis. So there's 2 other muscles that are working here that you can't see in this video, and that is the rhomboids, the rhomboid minor and major, and they're helping to adduct the scapula and downwardly rotate the scapula. So if you remember when we were looking at the scapular movements, a downward rotation is when this glenoid cavity rotates down and inward. So in this video, you can see a downward rotation of the scapula. Abduction or abduction is moving the arm away from midline. And the first muscle that assists with that is the supraspinatus. You can see here, this is shoulder abduction. So abduction is pulling the arm up and away from the body. So the supraspinatus is working as well as the deltoid. And from our pectoral girdle, we have the superior fibers of the trapezius, which are also assisting. And you'll notice in your white sheets, it says an upward rotation of the scapula under the superior fibers of the trapezius. And that is because within this action, the glenoid cavity is making an upward rotation. Lateral rotation of the arm is when the intertubercular sulcus moves laterally or away from midline. So this action is showing you both medial and the lateral rotation. So this is lateral rotation, right here and here. That is medial rotation, lateral rotation. So the muscles that assist with lateral rotation are the infraspinatus, the teres minor, and the deltoid. Medial rotation of the arm is completed by quite a few muscles. And again, medial rotation is when the intertubercular sulcus or groove rotates inward. So the first of those muscles is highlighted here, and that is the Subscapularis. And the motion looks like this. So we already looked at the lateral rotation, but this is medial rotation. You can see here we have the Pectoralis major, the deltoid, the Subscapularis, which we talked about, and also the Teres major and the Latissimus dorsi. Here is the Latissimus dorsi and the Teres major.